Preoperative renal functional reserve predicts risk of acute kidney injury after cardiac surgery. Abstract. Background: although acute kidney injury, AKI, frequently complicates cardiac surgery, methods to determine AKI risk in patients without underlying kidney disease are lacking. Renal functional reserve, RFR, can be used to measure the capacity of the kidney to increase glomerular filtration rate under conditions of physiological stress and may serve as a functional marker that assesses susceptibility to injury. We sought to determine whether preoperative RFR predicts postoperative AKI. Methods: we enrolled 110 patients with normal resting glomerular filtration rates undergoing elective cardiac surgery. Preoperative RFR was measured using a high oral protein load test. The primary endpoint was the ability of preoperative RFR to predict AKI within 7 days of surgery. Secondary endpoints included the ability of a risk prediction model including demographic and comorbidity covariates, RFR, and intraoperative variables to predict AKI, and the ability of postoperative cell cycle arrest markers at various times to predict AKI. Results: AKI occurred in 15 patients, 13.6%. Preoperative RFR was lower in patients who developed AKI, P0.001, and predicted AKI with an area under the receiver operating characteristic curve of 0.83, 95% to 0.70, 0.96. Patients with preoperative RFRs less than or equal to 15 ml per minute / 1.73 square meters were 11.8 times more likely to develop AKI, 95% to 4.62, 29.89. P0.001. In addition, immediate postoperative cell cycle arrest biomarkers predicted AKI with an AKI of 0.87. Conclusions: among elective cardiac surgery patients with normal resting glomerular filtration rates, preoperative RFR was highly predictive of AKI. A reduced RFR appears to be a novel risk factor for AKI, and measurement of RFR preoperatively can identify patients who are likely to benefit from preventive measures and/or to select for use of biomarkers for early detection. Larger prospective studies to validate the use of RFR in strategies to prevent AKI are warranted.